So again, welcome to Digital Health. My name's Erin, and let's proceed. I wanted to start with the fact that the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of the Squamish, Tsleil-Waututh, and Musqueam. And I recognize that you guys might be on different territories yourselves tonight. So if you want to take a moment to recognize that, that'd be great to yourself. We do ask that during the session, you keep yourself on mute so we don't have any interference with each other's voices or with the recording. So please stay on mute. If you have any questions as we are going along, you're welcome to pop those into the chat at the bottom of the screen or top, wherever it appears on your setup there. And some of those I might be able to answer during the course of the session, and some of them we'll answer at the end when we have a Q&A at the end of the session. But please do just pop those into the chat so that we have them there and so that we can see what you guys are thinking. Glynda probably won't be able to look at those while she's talking though. So our agenda for this session is the welcome and introductions, which I'm doing right now. We're going to do a short poll question. Then we're going to have some presentation and program overview, information about program advising, and a question and answer. And our main presenter tonight, after I finish all this introductory stuff, will be Glynda Rees, our program head for digital health. So as I introduce Glynda, I'm going to run that poll question I mentioned. Okay, looks like about 19 of you have answered. So I'm going to end poll and share the results. So it looks like we've got people from Vancouver Coastal, PHSA, First Nations Health Authority, great, PHC, and then a few that are not currently employed by a health authority, a couple others. So that's interesting. Thank you for that. And I will pass that over to Glynda now.
All right, thanks, Erin. So hi, everyone. I'm Glynda Rees. I am the program head for the Digital Health Advanced Certificate. As Erin mentioned, it is a brand new program. So we are excited to be here today, able to speak to you about the program and looking forward to our first intake of students in the middle of spring. So the week of April 17th. And just so you know, my background, I'm a nurse. I've been teaching at BCIT for about 18 years and in the BSN program, and now I'm working in the specialty nursing program and under the umbrella of the School of Health to put this program together and to kind of roll it out and get it up and running. So I'm really happy to be here and welcome. And today we're going to, as Erin said, just give you some ideas about what it is, what the program is, and have some opportunities for questions and answers. So what is digital health? Canada Health Infoway defines it as the use of information technology, electronic communication tools, services, and processes to deliver healthcare services, which is a really broad, broad title and an umbrella term for many kind of concepts that will lead towards roles that are mostly for the current situation in informatics roles in Canada, but will also allow for other roles that are a little broader and outside of the informatics scope under the digital health umbrella. The reason that we put this program together is because through my work and others across Canada in the informatics space, we've noticed that there is a need for digital health skills that prepare clinicians and other healthcare workers to work in technologically advancing fields. So as I'm sure you're all aware, the technological advances that are happening in society are particularly impacting healthcare as well. So preparing clinicians to work in these environments in a productive way that also continues to focus on the patient, their families, communities, and populations is important. So the technology is coming, it's here, it has the potential to transform healthcare, but we need to have the right skills and the knowledge to be able to make sure that technology is actually broad impact, it impacts healthcare in a positive way. It is an emerging and rapidly evolving field. So part of this program, one of the main intent is to make sure that we stay with the times and we stay relevant and we stay up to date on what is happening in the field. And we're doing that by maintaining lots of open kind of partnerships with our healthcare industry partners. And we have done that from the beginning of the kind of the first time, the first visions that we had of this program involved conversations and advisory groups and lots of back and forth between our industry partners and our health authorities in particular in British Columbia. And we continue to do that as we move through the program, and we will continue to do that in a way that is sustainable, as by having the conversations, by bringing healthcare experts, subject matter experts into the program to, support the teaching, support presentations, support students as mentors, and prepare you for your capstone project, which I'll get to in a minute, as part of the program, and ultimately for practice in this environment. Digital health professionals are needed across Canada and beyond, and it's this is a time when we have a healthcare crisis that is not being solved anytime soon, and technology is one component that has the potential to help with the healthcare crisis, to actually inform how we can do a better job in healthcare, and a lot of that is related to data and the combination of technology as well. So we've developed this program. Yes, next slide, please. Thanks, Erin. So you're hovering over the thing ready to go. The program we've developed is part-time, it's online. It is meant to sort of meet you where you're at as a student. So the part of the reason that we developed this program is also because not everybody is ready to take on a master's program. So this is meant to be something that you could take as a full-time worker, that you could take it in conjunction with your work. It is completely online. Any synchronous classes we will have in the evenings. We don't have a lot of them, but when we do, we would record them. We try and work with you to make sure that it would meet the student, the cohort, and be at a time that works for most of the students. But also, if you can't make it, we would have recorded sessions as well. Oh, sorry, you went one back. There we go. It's late on a Monday, Erin. It's online, it's part-time. All the content is meant to be relevant, current, and so we're using a case method approach, so that we pull on case studies that have been developed by subject matter experts in Canada, and with faculty and instructors and educators supporting that transition, to make sure that the case studies we use are educationally sound. And the intent is that the discussions that students have would then be around those case studies, and would allow students to kind of do deep dives into case studies in their own different roles, and then bring them back into the classroom to discuss and kind of resolve. And so the content is not meant to be reams and reams of reading, reams and reams of writing. It's more conversations, discussions, and our assignments are also all comprised of kind of building blocks that will lead you towards your capstone project, which would happen at the end of the program. And so your assignments are mostly more project-based. There might be video content where you're doing presentations, or kind of reflective papers, really looking at more sort of short, relevant papers if there are any, but most of your assignments would be project-based and relevant to your clinical site and your capstone project. If you are not working at a clinical site, we do have partners who have projects and interests, and we have a lot of support from our clinical health authority partners who want to mentor and sort of support students in these roles so that when you graduate, that they can bring you into roles in practice as well. And so we have 7 dynamic online courses that will build towards this capstone. And I do have a program map that we'll show you in a slide so you can get a sort of a visual of what that might look like. Next slide, please, Erin. So is this something that would be for you? So I'm assuming that by being on this session today that you have some interest, but really we're looking for people who have an interest in the field of digital health and informatics, of course, mostly healthcare professionals. But we're also, if you've been in the healthcare industry and you understand sort of how the Canadian healthcare system works, then we'll speak a little bit about the application process, but there are some opportunities there as well. If you're looking to know how you can work with technologies and how they impact healthcare, how to make a positive difference, and how digital health is a possible strategy for solving this or helping to solve, working towards solutions for the healthcare crisis that we're currently in. So having that background in healthcare and interest in technology and a desire to make a difference are a good combination of characteristics that you might have if you're interested in the program. Next slide, please, Erin. Thank you. So the end of the program, among many other kind of learning outcomes that we're working towards, and you can see on our website, which you would have obviously come to through when in getting to this program, and we will have that link for you available as well at the end. But the sort of main skills that you will have will be around the clinical translation of standards, technology, and information solutions across healthcare systems. We have 2 courses related specifically to data science, data analytics. And then throughout the whole program, we do have change leadership and project management threaded throughout all the courses as well. Next slide, please. So this is the program map, and this gives you a little snapshot of what the program could look like if you took this within a 1-year compressed framework format. So you could take it all as 1 year, but you are welcome to also do it part-time up to 5 years. And we sort of capped it at 5 years because we wanted to stay relevant. But if you needed to take longer than that, then there are ways around that as well. But if you wanted to do this in 1 year, it would look like this. Digital Health Foundations is a prerequisite or a co-requisite to all the courses. So it's that foundational course that really just introduces you to digital health, to some of the concepts, the principles, the frameworks, as well as leadership, role transition, and project management principles as well. And that sets you up with the foundation for the other courses. So health information ecosystems, and I apologize, we've actually changed this. We're calling this course Digital Health Ecosystems, and that's my fault. I gave Erin the wrong map with the old name on, but it's Digital Health Ecosystems, and that's what you'll see on the website. And the idea in the sort of concept of that course is that it's looking at all the different systems that we're using in all the different environments in healthcare, whether it's acute care, community, virtual care, how those all interact with one another, the interoperability of these systems, some of the privacy and security challenges, the standardization of data across the systems, etc. And then we also bring in some change management into that course, and a little bit around the sort of project management, change management as well. And then the data fundamentals course, which is 7200, is that introduction to data, data science, sources of data, where data standards, kind of the importance of data, privacy and security around that. And then also within that program, we bring in some statistical literacy. So we originally had thought that for the data course, we would require a stats 101 to come into the course, but we've decided that for most people that even if you've done a stats course, you might not have used it or looked at stats again since you actually first completed that program. So we have 3 modules in this program within this course, within the data fundamentals course, that speak to stats and statistical literacy, and really just will help you to read reports and analyze graphs and kind of data, and do some data mining, data cleaning, and that will prepare you for the data analytics course, which is really taking the data that is generated by in so many environments in healthcare, and more now in society, and by patients themselves, to pull that data together, be able to tell the data story to patients, families, or other stakeholders, or leadership within your hospital administration. So helping take that data and turning it into a story. So then that data analytics in the second term builds on the first course and helps with that kind of translation of data. And then 7300, 7400. So these courses in this term 2 will all be offered in the fall of this year. So those are kind of the next set of courses, and those really look at taking all the principles and the knowledge and the theories that you've learned about in the first term, and applying them to practice in these sort of unfolding case studies that will make it very relevant. And then the final sort of term is the Project Leadership in Healthcare, which is a pre-existing course that has been running for several terms now under the Healthcare Management Program at BCIT. So that if you go on to our website and try and register for this program, that comes up as a course that you could register for, and you are welcome to take it at any point. But really, it ties quite nicely with the capstone project. So if you are planning out when you would want to take these courses, we do recommend that you take it a little bit later in the program, just because it ties well into the capstone and will build on a lot of what you have already learned throughout the program. And then the capstone is done at a clinical site, and will be relevant to whatever practice area you're interested in, and area. So if you're like, I live in Surrey, I'd like to do something with Fraser Health at the Surrey Memorial Hospital. We have, lots of contacts there that we'll be able to connect you with to do projects in that realm, and the same as, other parts of BC and Canada and beyond. And you also will be, encouraged as well to, bring any areas of interest to our attention and we can help support you with a project that might be relevant to wherever you work, that you have interest in as well. So that's a general overview, and we will have time for questions at the end to sort of give you an idea. And then I think there's one more slide for me, Erin, and that's really just around our educational approach. So you've heard me talk a little bit about what this looks like. We are interdisciplinary, so across healthcare professions and informatics roles. We are really focusing on being learner directed, having students direct the conversations, equity oriented. So we have a diverse faculty, we have diverse content. We try and look at all of our case studies through an equity oriented lens, really taking social justice into account, and inclusivity within the program. So we have some content around that is on the website as well. We also are team-based, so there will be some team learning and cross-learning across student populations to support and learn from one another. Change leadership, because that's a huge part of what we're dealing with here in society, but within these technological areas. Project management is a huge part of what these roles involve. So being able to manage projects, ultimately lead projects, will be part of the intent of this program. And it's typically not something that we learn in our undergrad in healthcare programs. So we will start with sort of an introductory level and build that up. And then flexible learning. So really trying to meet students where you're at, understanding that you have lives and that you have, most of you will have jobs and other things going on in your world. So looking at how we can accommodate your learning in that way. And then that case-based piece where we're maintaining that relevance, maintaining the currency of the content, keeping those conversations and partnerships open with our healthcare partners as well. So that's our approach. And again, we'll have questions at the end, but Erin, do you want to jump in with your...
Sure. Yes, thank you, Glynda. I hope that was helpful for everybody. Again, I know some of the questions in the chat I was not able to answer yet, and they're best answered by Glynda. So we'll wait those for the end, but thank you for putting those in there so that we can flag them for discussion. So how do you get into the program? What are the entrance requirements? So like any BCIT program, we do require that you have 2 years of education in English in English-speaking countries. So that doesn't mean that it needs to be 2 years of post-secondary. We are just looking for a good grasp of English of that part. So you should have English Studies 12, which used to be called English 12, at 73%. Or 3 credits of post-secondary English, humanities, or social sciences at 73%. You also need to have some post-secondary education, either a diploma, degree, or equivalent accredited program in a healthcare discipline. So we are looking for people with a healthcare background. There is an alternative entry option if you have a diploma, associate degree, or bachelor degree in another discipline from BCIT or another recognized institution, and at least 1 year of experience in a healthcare environment. So some non-academic entrance requirements. All of our applicants must complete a pre-entry assessment form to have their education experience and interest assessed by the program area. So those forms are on our website. So if you complete one of those pre-entry assessments, it's a PDF form, and send it by email right to Glynda_Rees@bcit.ca, and we'll have her email address up again later in the presentation here. Send that in, and we will look at it. Glynda will read all your answers on that form, and if she signs off on that, then you will submit that along with your online application at bcit.ca. So our application period is all year round because we have courses running in all 3 terms, and BCIT runs 3 terms a year. January to April is our winter term. April to July is our spring term. September to December is our fall term. So once you apply, your studies just begin at the start of the next term following acceptance. So if you apply in January and accepted in March, you can begin your studies in April. Fairly straightforward. We can answer any questions about that in a bit. Again, Glynda did say that you can complete the program in 1 year if you condense it together like the program map had, but you do have up to 5 years to complete the program because we know that not everyone can do 3 courses at a time. That is very heavy and a lot to do. So definitely 1 course per term if you want to do it that way. You have up to 5 years to complete it. So the application steps. So you review all the requirements and the application dates and all the information on our website. That's a very important first step. There's a lot of information on our website, as well as what Glynda has shared tonight. You complete the required forms, get that signed off, and then you convert all your documents to PDFs, apply online at bcit.ca. Everything that we do at BCIT in our application process is done online and digitally. We don't want anyone mailing a hard copy of their transcript into us. So everything gets scanned, turned into a PDF, and done online. If you have already gone to BCIT, we don't need a copy of your BCIT transcript because we already have that on file. Just let us know that you went here. Just make a note of that, and we can pull it up digitally ourselves just as easily as you can. So again, the academic entrance requirements, proficiency in speaking and listening in English, English Studies 12, like we mentioned, at 73%. Post-secondary education, either diploma, degree, equivalent accredited program in healthcare. Admissions process. So again, once we receive all your documents, once everything is approved by the Digital Health and DHAC, DHAC is our acronym that we're using for this program because BCIT loves acronyms. So DHAC program head Admission sends application letters out, and then you are required to pay a commitment fee prior to your full tuition or your full course fee being due, I believe. And I want to talk a bit about some of the supports available. So if you choose to take our program and you get in and you start the program, you have all of the BCIT student supports available to you because you're considered a BCIT student, even if you're taking one course per term. So that means you have access to everything on the screen here. First one being our Indigenous Services Department, and they have a welcoming gathering place on the BCIT Burnaby campus, where students who identify as Indigenous or anybody who's interested in learning more about Indigenous peoples within Canada are welcome to join in, come for a visit. There's all kinds of activities that they host and all kinds of sessions that they host, and it's a great place to gather together. Student Financial Aid and Awards, as it sounds, is your place for all information about financial aid and awards and bursaries. Accessibility services, that is for anybody who has a need for accommodation in a program or a course. If you have either a short-term or long-term disability or a condition where you need some kind of support beyond what is given to the whole class, you would reach out to accessibility services and talk to them, and they would arrange that with your instructor directly. Student health services. All BCIT students are welcome to access student health services. We have a full-time doctor and nurse run health clinic on our Burnaby campus. And it's sometimes easier to get into there than it is to see your own GP with wait times, or if you don't have a GP. So they're kind of a good resource to have for when you just can't get in somewhere else. Counseling and student development, they're in the same building as student health services. And again, free counseling available to all BCIT students for whatever you might need that counseling for. And we also have recreation services. As a BCIT student, you get access to our full service gym, weight room, cardiac machines, fitness classes that we have going on. So there's lots of kind of benefits to being a student here at BCIT. Now, if you have any questions after this session that we don't get to, you have a few options. One being to contact program advising, and their information is on the screen here. They're kind of the go-to people on how to apply to something. Do you have the right skill set to apply to something? So if you have questions about things, you can definitely contact them. However, Glynda is also always available because this is a program that she's really spearheading here. So she is available for all of your questions as well. As you kind of decide whether or not you'd like to pursue this, if you'd like to learn more about BCIT and School of Health at BCIT, or if you just like to see what we're all about, I would love it if you would give us a follow on Facebook or Twitter, Instagram, YouTube, LinkedIn, whichever one or two are the ones that you prefer to use yourself. I know not everybody is on everything, but we do have a lot of great content on there about all of our different School of Health programs and about kind of life as a health sciences student at BCIT. And again, on the screen, there's a number of other ways to kind of learn more about BCIT as a whole. But for now, I'm going to take it over to questions and answers. So Glynda, got a few questions here. So Alice Chung is asking a question. What kind of jobs can this program lead to? Is this program more geared for RNs or for a specific background?
So the first part of your question, I would say currently most of these roles are geared towards informatics specialist roles and informatics leaders, as well as clinical analysts. So within the healthcare setting, we have, because recently we've had a rollout and go lives for electronic health records kind of across the province, certainly within Vancouver Coastal, and Fraser Health is starting that process as well. So there's a lot of requirement for these roles. The New St. Paul's, they've got a new hospital coming, and there's many roles associated with that. So, we're kind of using digital health and informatics a little interchangeably. Digital health is a bit broader than that, and there are roles, I think, that don't even exist currently that will be coming, and that will be, our intent with this program is to prepare you for anything related to sort of technology as it intersects with healthcare. So lots of job opportunities. The program is not specifically geared for nurses. It's open to all healthcare professionals, healthcare, allied health, sort of anything within the sort of healthcare region for the most part, as long as you have a diploma or degree in the kind of required credits to meet BCIT's competencies, meet BCIT's criteria. And then we do, I think, as we said, that you have this alternate entry option. So there are some other kind of case-by-case basis that we will look at as people apply to the program. So I would say if you're not a nurse, you think you're interested, you're not sure if you meet the requirements, if you complete the form that's on the website and send it to me, and then I can review it, and then I will connect with you to ask more questions and kind of give you some feedback on what might work or might not work. So hopefully that answers your question, Alice.
We have a few questions about possible clinical sites. Now, I know you mentioned that most people would be doing their practicums or their clinical through their current work site, but can you talk more about where some possible clinical sites might be if you don't have that?
So we have lots of interest across the province in BC, as well as beyond, in kind of different areas. So for example, in some of our kind of community sites, so kind of clinics and outpatient services, looking at how they can maximize and optimize the use of technology. So they're creating roles and have projects in those areas. Some of our certainly all of our health authorities are looking at informatics roles as they roll out all these technologies. We have quite a bit of the program looking at artificial intelligence and what that means in healthcare. So there's opportunities there. There's private companies that are looking for clinical expertise or expertise in these realms to sort of support some of the projects and things that are happening in the space. So there's lots of opportunity and there's lots of interest. And so for potential employers, they want to help contribute to the kind of the type of student that graduates from this program. So they're very keen to support us with mentorship along the way and to lead into these capstones. So right from sort of, the first few weeks, once you're in the program, you kind of settled, then we start looking at what your interests are and where you might want to work, or what, not only the area you might want to work in, also the kind of type of, what your sort of, passion, I can use loosely, like what your area of interest is within this role, within the space, and then also where you would like to work. Do you want to be in a hospital, or do you want to be in a clinic? Do you want to be, virtual care is becoming something that is very much a kind of top of mind for lots of kind of healthcare settings right now. So looking at how we can support those projects. And so that mentorship piece will start happening right away. And then the idea is that you will make connections with people within these realms that you are interested in. You will have one assigned mentor, but they will introduce you to other people, other relevant parties in the system that you're in. And then as you meet people and develop those relationships and work on projects and assignments with teams, then you will be exposed to those environments, and potentially there will be job opportunities there as well. So that kind of close partnership that we have with the healthcare system in general will set you up for jobs down the line. And for some of those, we have ideas of what those might look like. And I think there are also many new jobs that are coming down the pipe as well that we'll be hopefully preparing you for as well.
Okay, thank you, Glynda. I have a question that's hopefully a shorter answer, an easier one for you. What are the course fees? How
So,
much are courses?
so currently, our courses they're part of the flexible learning program. So it used to be called part-time studies. We're changing it to flexible learning. And so the course fees are, you can enroll on a course by course basis. So each course costs around about $900. We're right at the end of the fiscal year, so that, for the new spring term, there might be a little bit of an increase to accommodate, life and everything. But right now they round about the 900 mark for each 3-credit course.
Thank you. We have someone asking about computer skills. How many tech skills, how much computer skills do you need to be in this program?
So great question. You do not need to be like a tech guru or like a computer whiz. Really, you need to be able to look at how technology intersects with humans and healthcare, and being able to understand kind of, life outside of just the computer, and how technology can be used to improve and optimize, patient outcomes and relationships and, kind of projects and all the different components of what happens in the healthcare system. So being able to interact with humans, I would say, in a meaningful way is probably more important than being able to be like a computer geek. So
good answer.
It's a weird answer that I just gave, but so yes, it's not a requirement, I guess, is the short answer.
Yeah. Navneet is asking, what type of experience would make an applicant stand out? Now, this might be a tricky one.
Oh, that's a tricky one.
Yeah.
What type of experience? I think probably just building on what I just said, right? We were looking for people who have kind of a broader understanding of what the healthcare system is about, what happens in healthcare, what's important, what does data mean, how can it impact patient outcomes and improve and optimize health. So, I would say tell us a bit about yourself, and you'll see in the application it's not all academic, right? We're looking for what is it about this program that interests you? Why do you want to do it? What brought you to this, and where do you see it taking you, and what would you want to get out of it? So that'll help us sort of figure out what might be applicable.
Okay. Sandeep is asking, he says, I'm a pharmacist working in the community. Are there opportunities in the HAs for me if I complete the certification? That's Definitely. A broad question too.
No, it is, but it's also for the pharmacy world of technology and informatics is booming, and there's a lot of opportunity within the pharmacy, not only in the health, like in the hospitals, but also beyond as well. So yeah.
Jen is asking if there's a potential pathway to a master's in digital health informatics.
Yeah, so great question, Jen. So we have a little note there saying I think it doesn't quite say this, but basically we're in conversation with several universities. So the University of Victoria, they have their health information sciences masters, and so they're very keen to sort of look at possibilities for laddering into their program. Or if you're in the program, you could take some electives. So if you did this program and then you went on to do a master's, your electives would have already been done. There's also UBCO is looking at a digital health master's. They're putting that together, and we're in conversation with them about what that might look like. Northeastern University out of the US is also very interested in what we're doing. They have a Vancouver campus, and so looking at how we can get some credit for credits, so that so you could do a master's. It wouldn't cost you nearly as much as if you did it just as a full program, and then these courses would be recognized as well. So nothing like absolutely firmly in stone, because part of the problem is that because this is a new program, the master's programs are kind of looking at us to say, okay, let's see what this, we want to see what this looks like before we will say yes for sure that we will recognize it. So we're in a little bit of limbo, but anything that we've talked through with anybody has been, very positive and wanting to have those conversations and make sure that we have that pathway for you. And we do that quite a bit with our specialty programs at BCIT. So we have the framework in place. It's just kind of setting up the logistics.
Okay, great. There's a lot of good questions in the chat here, so this is really great. Thank you all. We have another question. What are the possible schedules? Are there any specific time that courses are at? How many hours per day or per week are we expecting here?
Yeah, so for a 3-credit course, what we're saying, because you're not doing, we won't, if you were taking this in person, you would come into class once a week and you would sit in the class for 3 hours. You'd get a little break in the middle and it would be 3 hours of like study or learning. So the format of this is different because it's asynchronous, it's online. There will be some synchronous sessions, but they won't be 3 hours. It might be an hour or, maybe 90 minutes. So the intent with that is that you use the rest of the time, the rest of those kind of hours to line up with this credit structure, to do discussion postings and respond to your peers online. And so we're anticipating that this would probably take about 5 hours of your time per week. So it's like that, doing the reading, as if you were preparing for a 3-hour class, you would have some readings to do before, you might have some homework to do after. So if each week would be anywhere between 3 and 5 hours. Some weeks might be 5, a little bit more, and some might be less than 3 hours. We do have every course has 1 week where the students, so in week 11 of every course, we have an emerging technologies theme. So in week 5 or 6 of each course, the students in that class will get together and sort of do a kind of crowdsourcing voting thing where you put out ideas as to a topic that either isn't currently in your class that you would like to learn about, or something that's in your class and you want to do a deep dive into that content. So in week 11 of every program, there's just a show up and listen to a subject matter expert on whatever that topic is that you chose. So like week 11 there'd be no work. So it kind of balances out anywhere between 3 and 5, and some weeks will be less and some weeks will be more. Again, a more complicated answer than was necessary probably, but hopefully that answered your question.
Okay, we have, would this program help prepare for project management certifications such as PMP or PMI?
Thank you for that question. Yes. So for the project management, the PMBOK, there is a required number of hours, and I want to say 35, it's either 35 or 38 hours of education that you have to sort of have to be able to be prepared for that. So yes, these hours would count because BCIT is a sort of certified BCIT meets the criteria, so you would have some of that. It won't, there will be some additional studying that you would need to do for the certification, but we will set you up for that, and we will have some kind of subject matter experts again in that project management field, especially in that project leadership and healthcare course with the healthcare management program, that can help guide you through some of that and some of those resources and those processes as well. So yeah, great question.
Paul, would you like to unmute and ask your question out loud? I think you've got your hand raised.
Hello?
Is that Paul? Yes.
My question is this. I work with the biomedical department at Vancouver General Hospital. So okay. I'm actually interested. I don't know if I stand a chance.
Is that your question? If you stand a chance?
Yeah, to come in, yeah.
Yeah, so I think everybody has a chance. So I would say if you complete the form, and then I can look at, kind of what some of your background is, and then I will connect with you and either say, yes, this is perfect and you're approved, or we'll need to look at other options and alternatives. But yeah, you can start the application process. There's no fee. You just send in the email to me, and then we can kind of get that conversation going.
So the form, are you sending the form to me?
It's on our website, Paul. So if you go to BCIT Digital Health, so just type in BCIT Digital Health and you'll find it. The form is right there on our website.
Okay, cool. Thank you so much.
Okay, thank you, Paul.
Okay.
I think I have one more question before we're going to close this up. And that's a question from Jody, and it's a good question. She says, will the introductory course also run in the fall term this year and in January 2024? So will that introductory course run in every term?
Yeah, so our intent is to run all these courses every term. So yeah, unless we can't absolutely promise, because there might be a term where we've only got, one applicant to one course, and then we'll be like, okay, we just can't run this course. But we're not anticipating that at this point. There seems to be lots of interest. Along those lines, I will just say a couple of things. Our seats are filling up. So if you're interested, get your application in. And if you don't make it in this term, then there will be next term as well. There was another quick question around, I didn't actually fully answer one of the questions around the class times. Any synchronous sessions we have will be in the evenings, usually sort of between 6 and 8 p.m. And they will be recorded. So if you can't make it, they will be available to you. So, but we do try to work with people because we anticipate that you're all working full time. And yeah. How many students per term? So we're starting this first cohort with a smaller number, so probably like 12 students. We might have some in the introductory course. We can go up to 24, and then it will be 24 students per term after that.
Wonderful. And if you have any additional questions, I do have Glynda's email up here on the screen, and also program advising that I mentioned. Again, please do reach out, ask us questions, look at that form on our website, look at all the information on our website. There's a lot of useful stuff there. But we do have to cut it off there for this evening. Again, we want to really thank everybody for turning up. It's wonderful to see so much interest and to have gotten so many applications already for a new program at BCIT. And I think this is really going to be a great program carrying forward. Again, like Glynda said, a lot of interest from the health authorities and locally from this program. So again, thank you very much for coming. And I hope that we provided you with some useful information tonight. Yeah.
Thanks, everyone. And yeah, please do reach out, and I hope to see lots of you in our classes in the spring or fall. Take care.